Hello, let's talk about inequality around the world. So when we're talking about inequality, what exactly are we pointing to? Well, there are a couple of different measures that you can use to determine how unequal countries are. The first and the most common is based on the wealth of a country or the GDP that it can produce. That gross domestic product gives us an indication of how much in a global economy an individual country is capable of producing. And we often say GDP per capita because we don't just want to look at the pure dollar amount that a country is bringing in. We want to look at how many people live in that country and how that wealth is somewhat spread. Now, as you can imagine, a straightforward GDP per capita doesn't give you a perfect picture of the equal spread of wealth within a country, but it is a useful starting place. We can also look at the quality of life that people experience in a country, and that helps to give us a little bit more broad range of comparing not just the wealthiest individuals in a country, but also how people in poverty may live. And we want to look as well at the access to basic human needs that people experience in a country. So these are different things like food, shelter, water, basic sanitation, healthcare, what kind of access individuals and, across the board, not just the wealthiest individuals, but all individuals in a country, what kind of access they experience to these basic needs. All of these things come together to give us a better picture of how inequality expresses itself between different countries. And it is one of the areas where we start to see the sharpest divides between some of these different categories we've established. This is one of the strongest bases that are given for the north-south divide in IR, as well as, the developing, developed, underdeveloped designations that countries are given. We do see pretty stark divides here. Now, again, a warning, as we've talked about, anytime you start to paint the world with these kind of broad strokes, you do run into issues of individual countries maybe, or maybe not falling into these categories that we try to paint. So anytime we look at a map like this, don't look too specifically, because we're really going to look at each individual country in context to understand where it may fall in this kind of designation. Now, as we're looking at access to basic human needs, what kind of picture do we see? Well, to be blunt, it's not a great one. Looking at access to water, 1 in 5 people around the world don't have access to clean water consistently. And sometimes this isn't access to safe water either. A good example of this was a group of Engineers Without Borders who went to a site in Kenya where they wanted to build a well for a local farming community. Sounds like a pretty straightforward effort as far as going in and doing some humanitarian intervention. And so they went in, they built the well, after a couple of years of developing the project, built the well, went back the next year and found that the well had been gated off to the community. And so they asked the local community members, well, what happened? How did this happen to the well? They said, well, as soon as you left, a local warlord came in and decided that he wanted to bar access to the well, only to those who could pay him to do so. So, when we're looking at this kind of statistic, we're really looking at who has access to not just clean water, but safe water consistently. We're also looking at questions of sanitation in these basic human needs. And sanitation is one of the worst problems that we see around the international community. Approximately 40% of the world lacks access to basic sanitation. Now, unfortunately, this puts that population at an increased risk for contamination in their food, in their water, in their access to medicine, and that in and of itself leads to an increased proclivity to disease. And so these, as you can start to see, these problems sort of compound one another. Another compounding facet of these issues is that approximately 1 in 5 people around the world are homeless, don't have access to consistent shelter or a place to live. Now, this makes it more difficult for these areas to have proper access to healthcare as well. While 80% of the world's population lives in what we refer to as the global south, only approximately 30% of the world's trained medical staff does. So there's a deep divide here as far as access to proper medical technology and proper medical training. This also extends to the research and development of drugs. Only approximately 5% of R&D around the world is in these areas. So that means that the medical staff of the world are focused on what we used to call first world problems. They are focused on the developed nations as that's where they live and work. There has to be special extenuating circumstances made in order for these research areas to delve into the issues that really face the global south. That means we see a pretty significant increase in the diseases that begin in areas that don't have access to these basic human needs. So things like tuberculosis, malaria, hepatitis, cholera, HIV/AIDS, all of these are at a disadvantage because they start in areas that don't have access to these basic human needs in the first place, and then expand in areas that don't have access to the basic healthcare rights that everyone should enjoy. Now, not to harp too much on the negative impacts of this, but when we look at one individual example like HIV/AIDS, we can see how much of a decimation effect this has really had. In HIV/AIDS, since its outbreak in the early 1980s, has killed more than 32 million people around the world. And it is primarily concentrated in certain regions, specifically sub-Saharan Africa. So those are the regions that have been hit the most. For a long time, the United States and the Western countries failed to react fully to the AIDS epidemic, and it wasn't until 2004 that we saw the peak number of new infected cases arise. At that time, we saw approximately 1.7 million people in a year get infected with AIDS. Now we're a little bit lower than that. We're down to 770,000 people annually around the world, but that number should still give you pause. That's still a pretty significant number to look at as far as the spread of a disease goes. Now, I didn't promise to get off the negatives just yet because we need to talk about global hunger as well. 1 in 8 people around the world lack adequate access to food. And this is a huge problem, obviously, because this can lead to malnutrition. This can lead to undernourishment. It can lead to starvation. And this puts people at, again, as these different factors compound into one another, it puts people at a greater risk for disease because their bodies don't have the nutrition elements that are necessary to fight off those diseases. So 1 in 4 children in the global south suffer from malnutrition, which leads to approximately 1 death every 6 seconds from global hunger. And it's not an issue of not having enough food. We have enough food in the world because while the global south is experiencing this issue of malnutrition and undernourishment, the global north is experiencing the obesity epidemic, and over access to food and the ability to eat too many calories in a day. So it's not a question of whether there's enough food, it's how that food is distributed around the world and who gets access to it. So all of these come together to give us a concept that we call the bottom billion. This is the 1 billion people around the world, approximately, obviously not an exact number, but approximately 1/7 of the world's population that is in an endemic cycle of poverty. They are experiencing all of these issues at any given time. They are experiencing starvation. They are experiencing hunger. They are experiencing malnutrition. They're experiencing a lack of access to basic water. They're experiencing a lack of sanitation, and they don't have the healthcare that they need to start to remedy any of these problems. And so it gives us a pretty bleak picture of how things are spread around the world. And these do fall into certain geographic areas that are hit much harder than others. And that is the legitimacy that it lends to the concept of the global south. So not the happiest of topics. Next time we'll look a little bit about what is being done to remedy some of these questions, or at least the theoretical approaches that we're taking to try to address them. Thanks. Have a good one.